And well, if the last few years have taught us anything, it's that mental health matters. And an unfortunate circumstance is knowing where to turn. Well, that can be a challenge. Local nonprofit Chris 180 is on a mission to make mental health resources safe, affordable, and accessible for all Atlantans. Take a look. Good morning, ladies. So great to see you.
Good morning. It's a pleasure to be here.
Okay, so first I want to say congratulations on winning the grant, being one of our community partners. And Kathy, I want to start with you. Tell us about Chris 180.
First thing I want to do is say thank you
for
selecting us as being a community partner, because we are so grateful. Chris 180 is a nonprofit whose mission is to heal children, strengthen families, and build community. We're dedicated to providing trauma-informed care and creating an environment where all people, children, adults, and families can thrive, can heal, and become the best person that they can be.
Okay, follow-up question quickly, Kathy. What is currently Chris 180 focusing on right now?
We're focusing entirely on providing trauma-informed care services through all of our programs, and particularly behavioral health and community programs, community services that fill gaps.
Okay, and what kind of programs actually do you offer at Chris 180?
Oh gosh, well, we have counseling centers across the metro Atlanta area. We're in Fulton, City of Atlanta, DeKalb, Gwinnett counties with full service counseling centers providing individual therapy, family therapy, psychiatry, the full gambit there, and serving people across the lifespan. So youth and infant mental health care up to adult mental health care. We are accepting all major insurances. We provide services through sliding fee scale, so families who need support eliminating those access to barriers have that as well. We're providing substance use disorder treatment, including programs focusing on families impacted by the opioid crisis. We recently started a medication assistant treatment program for substance use disorder, so that's combining counseling with medication. So we know that about 1 in 8 youth and families are impacted by substance use disorder, so one of those caregivers is impacted. So really looking to eliminate barriers there. We're in about 81 schools across the metro Atlanta area, and those counselors really serve as kind of frontline supports in those schools, so supporting the youth, the families, and the school communities. And then Chris 180 is also the first and largest nonprofit in Georgia to support LGBTQIA plus youth and their families.
Yeah, it takes a village.
Absolutely.
It really does. Kathy, why do you think this work is so important?
Gosh, I think it's critically important, and I think the pandemic has highlighted the need, because everyone experienced trauma. We all experienced a collective shared trauma that heightened everyone's awareness of the importance of mental health. And we've seen suicide rates increase, we've seen anxiety disorders increase, we've seen a lot of problems be either increase or be revealed because people are more aware that they need help.
Right. And actually, I love that you said, too, there is an emphasis for the LGBTQIA plus community, because I think speaking to that, we still see the correlation with the pandemic, but the mental health crisis is real, and a lot of those folks need extra help and need to know that they are also being taken care of.
Yeah, absolutely. And I think that links back to what Kathy was talking about trauma-informed care, being really aware of some of the barriers, the limitations, the apprehensions about accessing services that come with being a part of that community. So we just do our best to eliminate those barriers, to be really open, really supportive, really patient, and to have a service array that can address a number of things. So maybe people are not ready for counseling, but they need something, and we're just looking to be able to fill those gaps and be providing those supports.
And I'd like to just add that 22% of high school students considered suicide, according to the CDC research that was just done, and that's 1 in 4 kids. So that's alarming. 36.6 African American teens, children and young adults between the ages of 10 and 24 considered suicide. That is That's unacceptable.
Yeah.
And then for LGBT kids, it's 46% considered suicide and 18% actually attempted.
Well,
These are communities that are under attack.
Right.
And when they see ads on TV or decisions that are made that impact their communities, it just exacerbates the trauma.
it really does. And we are so glad that you're both here to highlight these important issues and bring a light to it and all the work that you're doing in your community. So thank you both so very much for being here.
Thank you.
Thank
It's a
you.
pleasure.
All right, learn more about Chris 180's services, make a donation, or find ways you can get involved online at chris180.org. Or you can just give them a call at 770-722-0080.